You've heard the expressions, oh, my aching feet and my dogs are barking, when people complain about foot pain. For some, especially women, the source of that pain comes from having bunions. But as News 4 Tucson's Sean Mooney reports, many are hesitant to seek help and get relief.
While bunions can be a result of genetics or a medical condition, most form by wearing narrow-fitting shoes like high heels over an extended period of time. Surgery can correct the problem, but according to a podiatrist here in Tucson, in many cases, people continue to suffer instead of seeking treatment.
There are a lot of stories out there that it takes a year to recover from bunion surgery, or you'll continue on pain afterwards, or it was a bad decision.
Dr. Alan Shih with Head to Toe Healthcare understands why people may fear having bunion surgery. After all, it does involve an operation on your feet. The bunion forms as a bump on the side of the big toe joint. The bunion worsens as the bone continues to turn in, encroaching the other toes. Dr. Shih says bunion surgery corrects the condition.
So typically we shave some of that bone down, and oftentimes there's a cut in the bone to shift the bone over. You have to release some tissue in the area too to straighten the toe, and then oftentimes that when you shift the bone over, it's fixated with a screw.
Dr. Shih says when the procedure and the treatment that follows are done correctly, pain is kept to a minimum, and most patients are completely healed and back on their feet in 6 to 8 weeks.
The bone is so much better on the side.
Diane Evans suffered with bunions on both of her feet for years. Despite having her own reservations about the surgery, when one of the bunions developed a cyst on top of it, she knew it was time to have the procedure done, and is now glad she did.
I can see the difference in my foot, the straightness, how he straightened it out. I can see that once the swelling goes totally down, it's going to be pretty much, it'll be back to normal.
It's exciting to see people's lives changed, and people who've had pain a long time and getting back to driving or doing things that they love to do.
Diane Evans says she is now planning to have the bunion corrected on her other foot. For more information on bunion surgery, go to the Head to Toe Healthcare for your health page at KVOA.com.